to this week's episode of the UHSussex Preceptorship podcast. My name is Harry.
And I'm Gemma.
And we're your hosts.
So today we're really excited to speak to some of our nursing colleagues from the Paediatric team and what they do in their preceptorship year. We've done a lot about us adult nurses, haven't we?
A lot, yeah. It's
enough.
About time, because I don't know a lot about the paediatric preceptorship ever there. Do you?
Me either. No, I don't. So first we've got Rebecca. So are you happy to just say a bit about who you are and what you do?
So I'm Rebecca Akehurst. I'm the lead paediatric practice development nurse at the Royal Alex Children's Hospital here in Brighton.
Perfect. And you've got some lovely people with you here today.
My newly qualified, almost ex-newly qualified now, so they've just finished their first year. I think I'll let them introduce themselves.
I'm Megan. I'm a paediatric nurse and I work on the medical ward in the Alex.
Perfect.
I'm Amber. I work on the same ward with Megan.
Perfect. So there's different, you've got the medical, surgical, all over, and all peds is based at the Alex, is that?
No, there's cross-site. So we are the Children's Hospital here. We have a medical ward, which the girls working on. So general medical ward, but they do oncology and diabetes. And we have mental health patients. And then we have a surgical ward, so general surgical ward, a dedicated HDU and a dedicated children's emergency department.
An actual adult hospital, but a mini.
With little
So this is really interesting.
Yeah.
Okay.
So guys, nearly a year. How are you feeling?
Really. It has been so fast. Yeah. I think feeling a lot better than when we started. I don't know about you, I kind of feel like I know what I'm doing now.
Definitely.
Yeah.
And just looking back to this point last year, the amount of development just feels like so much, which is great.
Definitely.
Yeah.
So had you heard about preceptorship before you qualified? Did you kind of have an idea of what it was?
I think like when we interviewed for the jobs and then being in third year, it was kind of mentioned to us. I guess as students that you will have a preceptorship programme.
Yeah.
I guess it's.
Yeah.
Did you not?
I mean, I knew, but I don't think I knew exactly what it
Yeah.
involved.
I knew there was one, but I didn't really
Yeah.
know what we'd be doing.
We were reflecting on this with the adults in our first one, and we were saying, like, my daughter thought my job was about boats because preceptorship.
Just trying to establish how well known it is, aren't we?
Yeah. So yeah, we found that quite interesting as well in the adults, didn't we? That there was like, I know that it's supposed to happen, but what exactly it entails is quite interesting.
I think we do try and tie in with the pre-reg team at the Royal Alex and try to introduce the concept of preceptorship to the student nurses. But I think actually the reality of the programme doesn't really come into fruition until you're in it, I guess.
I've got a lot to think about, I suppose, in that.
But it's good that there's talking about it before you start, so there's that knowledge before you come onto the ward.
And I think it makes you feel better as a student, knowing you're not just going from a student to a qualified nurse with no support. It's like that transition.
Yeah.
Yeah.
Definitely.
And what can you tell, just basically for curiosity and for my own benefit, what does the preceptorship programme involve in paediatrics? How many do you have, like, days? Or...
Do you want me to go with that?
We can explain it.
So we started paediatric preceptorship in 2022 because we had before we had quite small cohorts of newly qualified coming into the Alex, and they went on days with the adult trust preceptorship team with Cat and Mel, which is very good, but we felt that we had a huge cohort coming in 2022, so about 21 nurses came on that one, and we felt that we need to do bespoke days, have a paediatric sort of robust paediatric preceptorship program. So we did that in 2022, and it worked quite well. But it basically has a sort of learner-centered approach. We have a mix of 6 days with us, but we still link in with the trust preceptorship team. So they do day one with the trust preceptorship team, and then they do 6 days with us, and then they do the last day again with the trust preceptorship team.
And do the 6 days last, like,
so throughout the year,
out?
12 months it lasts for, and they have a mix really. All days are quite mixed up with skills-based stuff, simulation, nurse specialists coming in, and they do teaching in the group. And what we introduced is the P&A roles, the professional nurse advocates. So we run regular restorative clinical supervisions in the sessions. So we have that, and then we have we had a Padlet which we've moved on to Iris. So resources. And we have a competency book that is a children's and young people national competency book, and they start that in preceptorship, and that just goes on throughout their career as nurses in the children's. So that's what we do. They need preceptorship. It's really, really important. And luckily at the Alex, our managers are really supportive of us.
That's good.
It's great for retention.
The range of topics in preceptorship does give you that sort of foundation to be able to deal with it, and a lot of the things in preceptorship we go over, so you use every time you do it you're feeling more confident, so you can actually then apply it in practice. I think one of the most helpful probably mental health,
Definitely.
like SIMS, mental health training, just because we do see quite a lot of that at the moment.
I think everything you're doing when you're newly qualified is like the first time you're seeing these presentations, and I think obviously you can't cover everything, but a lot of the study days that we do in the SIMS like covers things that you're definitely going to see, like bronchiolitis, CAMS. It does prepare you a little bit more.
It's that exposure, isn't it? Like just some exposure to it, and you can go, oh yeah, I remember we did something.
Even if it's one thing that you remember, you're like, I know this.
Go back to it.
We've found with some of our adult nurses that people always get a bit nervous about simulations, so that's sort of real life scenario practicing and think it's acting. How have you found that process and that way of learning? Did you have experience of that with your university?
I think we did it at uni. I don't think it ever gets less awkward.
No.
Having to perform it in a big group, but it definitely is helpful, and I think you do take things away into actual practice.
You do it in the same groups, so you become more familiar with your peers, so it's not scary, it's just sim is always going to be a little bit awkward, but you do get a lot
so helpful.
We try to make it as safe environment as possible, relaxed, and we just want them to get learning out of it, and there's no point making it a sort of a stressful environment. They won't learn that way, so we try to do it in a relaxed way. We use some of the sort of high-tech technology, so you kind of suspend disbelief, but still it's always still a little bit awkward, but it's good. We run 2 groups, so they're smaller groups, so we run 10 in each, and they go throughout the whole year in their groups. So I think you're right, it does help with those simulations because they've got to know each other. Trust is built there. I mean, everyone says to me, oh, Rebecca, not sim again. I mean, I love sim. I think it's a really good way to learn. It's a really great way to learn. But I think at the end, when you see their evaluations, because we evaluate every study day we've had, the feedback is like really got something out of sim. So I do think it is a good way, and we do break into skills stations as well, and then we'll run that in the sim. So whatever they've learned in the day, we try to run in the sim in the afternoon.
What would you say, so throughout your sort of preceptorship experience, what's been the biggest benefit to you? Is it the skills, or is it the peer, or is it the support, or is it a mixture of everything?
I'd say it's probably a mixture of everything, but definitely the study days. I think it's nice to have that protected time to learn about something when you're not actually doing the job.
That time away from the clinical environment.
You can kind of ask questions, and you can be in that safe environment to do it. But the support's been really good as well. And just having someone say,
I'll pass it on to the other kids.
Cool. Guys, if you were going to give one bit of advice to those 18 about to start out on their preceptorship journey, what would that be, do you reckon? Anything in particular?
Just get involved and ask as many questions as you need to. Don't be afraid to ask for help.
Be honest, in the study days we do restorative clinical supervision, and just being honest about how you're feeling with everyone, so they know how to support you better and how you can support who you're working with as well, because especially at the start, it's scary.
Yeah.
But it's also, that you have good
Exciting.
days and bad days.
Just kind of take the ups and downs as they come.
Exactly.
Definitely. Thank you guys so much for your time.
That's okay.
We appreciated having you.
Thanks for having us.
Yeah,
thank you for having us.
It's been great.
Yeah.
Yeah. I learned a lot.
Fabulous. So thank you guys.
Thank you.
We'll see
See you,
everyone else next time.